The American Cancer Society estimates that nearly 311,000 women will be diagnosed with invasive breast cancer in 2024. That's about 1 in 8 women here in the United States. And studies suggest women with more social support have a better survival rate than those with less support. Here to talk about what you can do to lower your risk and get the support you need are Donna Yearwood, coordinator of the One Brooklyn Health Breast Cancer Support Group, and patients Nicole Semple and Angela DeFreitas. Welcome to all of you.
Thank you.
You all look great. So Donna, let's start with prevention. What can women be doing to reduce the risk of breast cancer diagnosis?
One of the things that women will be doing would be a yearly mammogram, also a yearly clinical exam, and at home they should be doing monthly self-breast exams. For people who have a family history of cancer, they should ask their doctor to have genetic testing done to see if they have cancer markers, and as well as eating healthy, proper diet, and exercise to help reduce breast cancer.
Okay. Nicole, receiving a breast cancer diagnosis can be devastating. What was it like for you, and how did One Brooklyn Health help you through the process?
Well, I have had many cancer diagnoses, but breast cancer is one of them. And of course, you know, receiving a diagnosis of breast cancer is extremely devastating. However, One Brooklyn Health has provided me with a great treatment plan and care, which I appreciate very much. And the support group, in addition to, has provided me with emotional support. They're a place to cry to, I should say, and just to share emotions, talks, and everything else.
Sounds like a good support group. Donna, you're the coordinator of the Breast Cancer Support Group. Why is actively seeking out support so important in the journey?
When women or men are diagnosed with breast cancer, they need the emotional support as well as shared experience support, meaning that we have people within the group are newly diagnosed, people who are being presently treated, and people who have completed their treatment. And also we have members who have been diagnosed years but are doing well. And they share their experience with the new members as well as offer comfort to them as well.
I wonder, you were diagnosed before you were 40. What was your message for women out there who might not be on top of their checkups?
I was diagnosed in my 30s.
Yeah.
And most African American women are diagnosed at an earlier age than their counterparts. 37, and you're recommended to have a mammogram at the age of 40. So technically, I would have been waiting 3 years to have that mammogram, and in the interim, I already had breast cancer. So if it wasn't for me doing my self-breast exam, which I found it myself, and seeking help at an early stage, it would have been more complicated.
Yeah.
And early detection is the best prevention.
Early detection is the best prevention. Well, you all are success stories. I know you weren't diagnosed, but you're doing all this great work. So thank you all so much for sharing your stories with us and with our viewers. Important work being done there. We appreciate it.
Thank you for having us.
Thank you.
To learn more about breast cancer treatment and support at One Brooklyn Health, scan the QR code on your screen or visit pix11.com and click on the Pix Partners.